Everyone, my name is Gabby Nielsen, and today I'm going to talk to you about medical interpreters. So to start off, I'm going to go over a few laws regarding medical interpreters, and the first one is the Civil Rights Act of 1964, which we usually think of when we think about Dr. Martin Luther King Jr. and rights for African Americans. But really what this does is it outlaws discrimination, which covers language services. A more recent law is Executive Order 13166, which was given by Clinton in the year 2000, and it requires interpreters for LEP individuals when institutions receive federal funding. And we later decided this also includes Medicare and Medicaid. Thinking, can't we just use a family member who's there? No, never. Well, why not? Well, sometimes people have a tendency to summarize what's being said instead of interpreting word for word what is being said. This means the doctor doesn't receive all the information that the patient is trying to convey, and the patient doesn't receive all the information that the doctor is trying to convey. This can lead to lots of miscommunication. Also, medical jargon can be very confusing, so it's important to have someone who is well trained in these sorts of words so that they can explain them properly. It can also be extremely traumatic for children. Imagine being 7 years old and finding out that your mom has terminal cancer, and you have to be the one to tell her that she has 3 months to live. Odds are you probably haven't had any experience with death before, and so this is going to be just terrible. Also, the patient tends to lose autonomy. If they don't know what's going on, they can't give informed consent. To further illustrate this point, I'm going to use the story of Willie Ramirez. He was a Cuban-American teenager who loved playing baseball, and in 1980 he was brought to the hospital. There was no official translator, and so they used his family to try to determine what was going on. Well, it turns out that his sister used the word intoxicado, which in Spanish can mean anything as mild as I ate something bad to I overdosed. And so the doctor just assumed that he had overdosed on drugs, but it was actually an intracerebellar hemorrhage. So for 2 or 3 days, they were treating him for the wrong thing, and it caused massive consequences. He ended up being quadriplegic, and he ended up suing his doctors. So what we can learn from this story is that we really need a medical interpreter, because had we had a medical interpreter on site, they would have known the nuance between intoxicado and what we think of as the word intoxicated. I hope that this story and the rest of this presentation have helped you to understand why we need certified medical interpreters instead of family members as we help our patients. Thank you.